Hello, Malden. This is Josephine Royal of Let Me Tell You Something. And I know everybody is sort of relaxing a little bit, and COVID-19 is still about a little bit, but we're opening up slowly. The governor is giving us guidelines on which to open, and I hope everybody's safe and still wearing their mask, washing their hands. If they can't use soap, use sanitizer, and I hope everybody's still safe. I know some people still working from home, and some people starting to be on the road. And again, as I always say, what comes from the heart does touch the heart. However, I have some wonderful people on the line too. Marion, and what is the other name? David. And these are lovely people that work at a center with the young at heart, I'd like to say. And they just dote on the people that go there, because one of them is my husband. And he just loves going there because he gets out and he gets to be with people his age, and he just, he likes going there. He calls it the club. And I'm going to ask them some questions. And I'd like the full name of this place. Could you tell me a little bit about it, Marion?
Sure. We're the Community Family Adult Day Health Center, and we service the elderly and disabled, and we provide a 6-hour program for them. And while they're here, we have 3 nurses on a day. They get all their medical treatments.
Can you hold on a minute, Marion?
Sure.
I want to go back to something so I can see it. Something's going on here. Okay, here we go. Can you go on, please?
So we service the elderly and disabled, and we provide a 6-hour structured program. We have a continental breakfast, lunch, and snack every day, and we have 3 nurses on every day, including myself, and we provide all medical treatments necessary that is ordered by the doctor for our participants. So it's like we are a medical model, but it's like they're coming in to get their medical needs, but they're not in a medical, it doesn't seem like they're in a medical facility. We're very home looking, it's very comfy. The staff are CNAs, and we're a 1-to-6 ratio, and they provide all ADL needs to participants as well. Anyone that needs help from the restroom to eating, to even helping them do an arts and crafts project. And we also provide transportation, and we pick our participants up and we take them home, and everyone first aid CPR certified as well, while all our van drivers as well as the staff.
Well, Marion, I know that you are on our end as well. Yes. Am I correct?
Yes.
That's wonderful. And David, could you introduce yourself?
Sure. David Corbett. I'm a development specialist. So I focus mainly on our fundraising. We are a nonprofit. Any of our communication needs, I process all donations. I kind of manage our social media and our website. So I'm working not just for the Everett location, but for our other locations in Medford, Wakefield, and Lowell.
Well,
our administrative.
Mm-hmm.
I'm sorry.
That's okay.
I was just going to say our administrative offices are located in the Everett building, but we do service all 4 of our centers.
Wonderful. Could you tell me, when COVID-19 started, what happened exactly? Did you close down right away, or was it gradually?
Well, when we started hearing about it and it got to the point where it was very dominant in the area, we first started with temperature checks as participants came in and off the van. We would do temperature checks. We would make them wash their hands, use hand sanitizer, as well when they walked in and throughout the day. We did an in-service with them explaining what was going on with the virus and spoke to them about frequent hand washing while they were here at the program. And also the center itself was sanitized at the end of the day. When everybody left, we wiped everything down with bleach. Even like they love to play bingo. That's one of their activities. We would even, we have a professional dishwasher, which sterilizes. We'd throw the bingo chips daily into the dishwasher. We'd wipe down the bingo. We would disinfect the bingo cards as well every day. And then suddenly, that was probably lasted a week of doing that. Our census fell down. People weren't coming in because they were getting nervous, and families were keeping their loved ones home. But we continued to do that. On March 13th was our last full day here at the program. The governor came in on Sunday, came on TV on Sunday, and closed things down. And we were one of the first adult day houses to close down. We stopped, so Monday, March 16th was our first day of closure. From that point, and what we've been doing since is we've been in communication with all our participants. We've been sending them activity bags. We've been calling, checking in, making sure they're doing well. And if they need anything, we've been providing that. Some of our folks have not had food. We've been able to bring them food. We have, to helping them shower. To check in. And most importantly, at this point now going on 9 weeks plus, we're seeing a lot of depression as well because they're isolated in their homes. And we try and provide a little bit of pick-me-up to brighten their day. I know this week we're making cupcakes, and we're going to be sending cupcakes home, to mostly everybody this week. And that was one of our things that we were supposed to be doing for St. Patrick's Day, because we missed the St. Patrick's Day party. We missed the Easter egg hunt and the Easter baskets and all that in the last 9 weeks. And these are things that our participants look forward to, and along with the entertainment that we have come in as well. So they're really hurting too from all of COVID. And as we move forward to reopen, we are working on that now. I'm on a task force, and we're trying to come up with the plan is to do it safely and to keep everybody protected and well.
What type of a plan do you think you will come up with?
Well, we haven't really gotten any guidelines yet, but we're looking at participants wearing masks, the staff wearing the PPEs, doing for lunch around our counter area, maybe doing some plexiglass so there's no grabbing of the food, because there can be some that will just come up to the counter and grab food, and we can't have that anymore, just to protect the food and us passing it out to everybody. Also, as well as the distancing, we're figuring out now the square footage and to distance and how many we can have and in our center. It will drop our census. Not everyone will be able to come as often as they did, but we're going to try and get everybody in the program to get out of their home and not be so isolated, and to have some something to brighten their day. So we really don't know at this point. We're waiting for some more guidelines from DPH. We don't know what it looks like yet. So we're in the beginning stages right now of it. So I really can't elaborate any more than I know the mask, the distancing, and keeping safe with the food as of right now.
I know for me, with my own family, I made sure that I got my husband out as often as I could, and even if it was just for a ride in the car. And I did that purposely because I knew that it was a good thing to do, and it helped. It helped, and doing different things. And, like even yesterday, we went up, my son's, and he's got a big place, and he was able to sit in the sun, and he loved that. Mm-hmm. What else? You said that you were going to make cupcakes and deliver. Do you have volunteers for that?
Nope. Staff has been, so every week I have a couple of nurses that come in with me, and our activities director comes in, and I have our van drivers. They come in, and they've been doing the drop-offs and the deliveries.
Wow.
And it's some sort of contact and connection. We just don't speak to some once a week. We've talked to some many times a week, the ones who are alone and have no families. There's a lot of our folks are alone and don't have families, and they're really hurting through this. And some even, have my personal cell number. If they need anything, they can call me anytime.
Now, did you ever think of how do I put it, volunteers to make phone calls? Like, I know in Malden they have helping neighbors.
Yeah, I think that's something that the city is doing for their residents of Everett. Our main focus right now is really dealing with our members and making sure that they're safe and that they're well, and if they need anything, that we can help maybe provide them with the services that they need and reach out to other vendors.
Mm-hmm. Now, tell me, so when they do return, what do you think that will look like? I know that you have a quiet room, and a lot of people like to go in that room, and you have an activities room and all of that. So how do you think that will manage? Because how many clients do you have that come all at once?
Well, before COVID, our census was 70. We average probably in the 60s on a monthly basis. Now we have to, I'm not sure, but I know that we do have to remove some furniture. We have to, make sure everyone's social distancing. We do have to have an isolation area in case someone should come in, and when we test their temperature, they have a fever, or if someone throughout the day is feeling sick, we have an isolation area away from our main area. And we do have that. We know what we're going to do for that. So that will work out just fine. As far as we do have a quiet area that folks could go in, and it is a small area. So at this point, I don't know what that will look like. Until we get more specific guidelines from DPH in the state, we really don't know what we can, what it's going to look like. It's going to be different. It will be different. We're going to have probably our capacity will probably be half, if not less, than what we had prior to COVID times. maybe if you want to check back with me, and maybe in a couple of weeks, I probably will have more information on that.
I think you're doing a fabulous job. I think the phone calls and all that you are doing, you and your staff, I think that was you've done a wonderful job. I realize there are a lot of people out there that do not have family, and it's hard on them. So I think that you've done a wonderful job at this point. My hat off to all of you. And I know that Richard has received phone calls, and he was happy to know that you made those phone calls. And I know that he's looking forward to coming back. I don't know what that looks like at this point, and we'll find out. We'll find out.
Yeah. In a couple of weeks we can chat again, and I can let you know what it all looks like and what our guidelines will be when we get them. I just want to say in closing, we're a tight-knit group, and I can say this for all 4 of our community family adult day health centers. They're our family, and they're like, we see them every day, and they're like family to us, and they are important, and we care about them. And this has just been horrific for staff as well, because they worry, and we have staff making phone calls from their home to clients as well. Mm-hmm. And we really miss them, and we just want them to be safe, and hopefully we can get back to some sort of normalcy for them.
Well, I want to say this, Marion. I thank you so much. And David, would you like to add anything?
No, I think Marion is probably a little more involved with, the day-to-day activities and the preparation in getting the centers started and opened again. But I'm trying to do my part, maybe more on the social media and on our Facebook page in particular, just trying to share some uplifting news in these not so uplifting times. So if anyone has good news to share that's related to the community family, we'd be glad to do that. And just encourage you to go either to our website or to the community family page on Facebook. And we look forward to getting everyone back in Everett and at all of our locations.
Okay. I want to thank you, Marion, and thank you very much. Matter of fact, a shout out to everybody at the community family. A shout out to all of them that have worked so hard to care for our loved ones. And I want to thank you very much. Marion, I'll be glad to take all the pictures that you send, and I will post them. And a loving thank you from my husband, because I know he cares very much.
Oh, he's awesome, though, Josephine. He's a wonderful guy, and tell him that we said hello and we're thinking of him.
Oh, I will, dear. And again, COVID-19 is something that none of us expected, and I want to give a shout out to all doctors, all nurses, all first responders, all healthcare workers everywhere, all over the globe. It's not just here in the United States of America, it's everywhere. And I want to give a shout out to Marion, David, and all the workers at Family Care Community Center. And lovingly, from my heart to your heart, please have a pleasant day. And I thank you immensely, Marion. Thank you so much, and for the opportunity to even speak to you. And have a pleasant day.
Thank you so much for talking with us.
Oh, my pleasure, my dear. Bye-bye for now. And again, I'll be playing something pleasant so you can hear it, and you'll be able to see this. I'll send you the link, Marion.
Okay, great.